just want to show you the structural differences between large and small intestine. Small intestine has a lot of this villi coming out, while large intestine is on the opposite way. It's called the pit. So both are increasing its surface area, but they look a little different. And I just want to give you an example of that very interesting architecture to effectively increase surface area in the small intestine. Think about when we talk about this respiratory system, we are adopting the small alveoli, which is only 300 micron, and that's small little ones, but we have 300 millions of them to increase its surface area almost 80 square meter, which is almost the half of the tennis court. So that big space, we are using it for gas exchange. Now for nutritional absorption, we are using a little different strategy, but also effectively increasing the surface area. And that shows like this. We have small intestine. We have, you see this circumferential fold, which effectively increased the surface area by about 3-fold. And when you look at inside more closely, you see this like this villi structure. And also this fold contains outermost mucosa and underneath submucosa, which connects to the muscular layer called the muscularias. And each of these fold, you can see this little protrusion, which is called a villus or multiple villi. You can see this villus is covered with epithelial cells. And this epithelial cell underneath, there's lots of capillaries and lymphatic. Specialized here is called lacteal in the intestine. And that forms this shape of villus, okay? And multiple villi. And of course, it's connected to the vein, artery, and lymphatic duct. And if you look at this single epithelial cell, and that single epithelial cell, this apical part is not smooth. It has, again, a lot of this fine, like finger-like structure that's called microvilli, which effectively increase the surface area by 20-fold. So let me give you a table to compare the small and large intestine. While small intestine, because it has smaller diameter, 2.3 to 3 centimeter, versus large intestine has 3 to 4, 5 centimeter diameter. While small intestine is longer, like 3 to 6 meters, while large intestines about 1.5 meters. Small intestines helps digestion and absorption of nutrients. Large intestine also helps reabsorption of the remnant food and also elimination of waste because it forms a stool. In terms of absorption, small intestine absorbs carbohydrates, proteins, fat, minerals, and vitamins, while large intestine absorbs water and some nutrients and salts. And small intestine is composed of duodenum, jejunum, and ileum. And that's connected to the cecum in the large intestine. The spelling is it's English, but the American English has a cecum, C-E-C-U-M, plus colon. The colon composes of ascending, transverse, and descending colon. And that connects to the rectum and also anal canal. So let's review about this small and large intestine. Small intestine is thus the longest section of GI tract or gastrointestinal tract, which absorbs most of the nutrients. And also it's a high volume water absorber because it's almost 5 to 7 liters per day. And the surface area, as I told, the circumferential fold gives about 3 times increase, and the villus structure increases about 10-fold. And up to the epithelium, single epithelium cells has a fine microvilli we sometimes call brush border from pathology point of view, because that looks like hazy brush from light microscopy. And that even increased to 24, which results about 600-fold increase in the surface area relative to plain tube. So this is a strategy that our small intestines is adopting. And that architecture is about 6 meters long and about several centimeter diameter, and 3-fold circular folds, 10-fold of villi, 20-fold microvilli. And very importantly, this is consistently meeting with outside food product or sometimes toxins and harmful substances so we can intake. And so it has a relatively rapid turnover in this epithelium, which lines villi. You know how often do they actually change or fluff off? Is every 3 days. And because of this becomes also a problem that it's also susceptible to insult if that influence mitosis, because it keeps happening. For example, a cancer patient who have to undergo radiation therapy, which damages the DNA, so it affects, it kills mitotic cell. Then small intestine cells are keep generating, and this radiation exposure makes the small intestines, it rapid turnover, and it kills these cells for temporarily. And as a side effect, the patients can go to diarrhea. Okay, so that can become a issue. And in comparison, large intestine, you can say as a drying organ because it makes a final stool. So it absorbs remaining water 1 to 1.5 liters per day. And also it stores undigested wastewater and material, and allows it to release under our voluntary control when we want to go to the restroom. And also a very interesting part of large intestine is it harbors a bacteria, which is symbiotic to our cells. And that has a specific role, which is still under very hot issue these days. And that bacteria converts dietary carbohydrates to monosaccharides for our absorption. So with this, we discussed about digestive system. Eventually what it does is breaking down of food into molecular components, and then nutrients will be being absorbed into our intestinal system and into the body, and liver also stores some of it as a glycogen. And for that, this interesting structure of layered structure in intestinal tubes, and our stomach and pancreas, liver, and small and large intestine has been covered. Thank you for your attention.